Good evening, guys. Good morning, good afternoon, depending on where you are. My name is Frances. I'm going to be doing a procedure today known as administration of suppository. It's one of the clinical skills and is a new additional skills. It's added to the new skills. Okay, so it wasn't included before. All right, so it takes 8 minutes to carry out this procedure. So you see the time is very short. We have to be conscious of our time. All right, so I have here with me gauze. This is gauze square, my hand sanitizer, my improvised ducolas, which is the suppository, lubricating gel. This is my patient. So I have the incontinence pad already slided under the hip and buttocks of the patient. So I have the bedpan. So this is the bedpan in the patient's room. So you can have bedpan, you can have commode or toilets in the patient's room, okay? All right, so I'm going to start now. So I have my prescription sheet here as well. So I approach my scene. I see my scene is safe to approach, nothing to trip me or fall. I'm happy to proceed. I'll draw the curtain to provide privacy and dignity for my patient. I'll do my hand hygiene according to WHO guidelines. Put an ample of alcohol gel on my palm. Rub my hand palm to palm. Right hand over left dosum with fingers interlaced and vice versa. Palm to palm with fingers interlaced. Fingers interlocked, rotational rubbing of the thumb, tips of the finger, and the wrists. Allow my hand to dry for 30 seconds and I'm happy to proceed. Hello, my name is Frances. I'm the nurse assigned to care for you. What will you like me to call you, please?
William Thomas.
All right, William Thomas. What's your preferred name?
William.
All right. Please, can I know your date of birth?
1st of the 1st, 1950.
Very good. Okay, William. Are you allergic to any drug, latest food, or adhesive devices?
No.
All right, that's fine. Please, William, can I double check with my paperwork and your wristband to be sure I have the right patient?
Okay, go ahead.
All right. So I have here with me William Thomas. Date of birth, 1st of the 1st, 1950. 1st of the 1st, 1950. Hospital number 001234. Hospital number 001234. Guys, please, when you're doing this ID check, you make sure you're looking at your paperwork and the wristband of the patient. Okay, it's very important. All right, William, so I can confirm that you don't have any red wristband on your hand and you're not allergic to any drug, latest food, or adhesive devices. And I can also confirm that on my paperwork you don't have any allergy at all. All right, so William, I'm here today to carry out a procedure known as administration of suppository. So it will be going into your rectum. Is a discomforting procedure, but it's going to help you for bowel movement and free you from constipation. So the doctors have prescribed this medication so you can have an easy bowel movement. Okay, are you happy for us to continue?
Yes.
So you can have some side effect like abdominal discomfort. You can have loose stool, that's diarrhea. Are you still happy to continue?
Yes.
All right, that's fine. So I'm going to drop this call bell with you while I get my equipments ready. So guys, this equipment must have been set up for you in some centers. So, but even if it's not set up for you, just have it in mind that you have your gauze square, you have your lubricating gel, you have your hand sanitizer, very important, you have your ducolas medication, then your bedpan should be in the patient's bed room. Then you have your disposable incontinence pad. All right, so I want to leave my patient scene now. I'm going to gel my hands. Very important. So I'll gel my hand. So palm to palm. You don't need to mention. You can just do it. Okay, so I'm going to put on my apron. All right, so I'm going to be confirming my prescription to be sure I have the right medication. So I have here with me prescription for William Thomas, date of birth 1st of the 1st 1950, hospital number 001234. So I can confirm that the drug is Ducolas. The dosage is 5 mg. So I'm giving just one Ducolas. So it's as required. That's the frequency. The route is per rectum, which is PRO, and the time is now 8 o'clock. And the date is the date of your exam. Remember, so the date of your exam will be there. Okay, so the prescriber's name and signature is here. The doctor's name is B Clan, and the so I can confirm that this prescription is legible, is valid, and so I'm happy to proceed. So this patient is not allergic to Ducolas. Okay, so I'm going to be checking my Ducolas, please. So you need to check your medication. So I have here with me Ducolas. I have the dosage is 5 mg. The batch number is 21, that's 21217. So, and the expiration date is 1st of the 1st 2025. So this medication is intact, is well sealed, no, it's not open at all. So I'm happy to give it. Okay, so now every of my equipment is ready. So I have my 2 pairs of hand gloves. So you will need your 2 pairs of hand gloves. So I'm going to be proceeding to Williams. All right, Williams, I'm back. How are you doing?
I'm fine.
Okay, so please, can I confirm your name again, please?
Okay, my name is Williams Thomas.
All right, that's fine. So I have here with me William Thomas. Your date of birth, please?
It's 1st of the 1st, 1950.
That's good. So can I confirm your allergy status? Are you allergic to any drug, latest food, or adhesive devices?
No.
So that's fine. Okay, so I'm going to be double checking with my paperwork and your hand again, your wristband, to be sure I have the right patient. So I have your prescription for William Thomas. William Thomas, date of birth 1st of the 1st 1950, 1st of the 1st 1950, and the hospital number is 001234. So I can also confirm that William is not allergic to this medication, and I'm happy to proceed. All right, Williams. So I'm going to gel my hand, put on my hand glove. All right, William, so I'm going to position you properly in left lateral position, and I'll make sure that your buttocks is at the edge of the bed. Okay. All right, so I'm going to make sure that your knees are well flexed. You flex the knees of the patient should be flexed. So in the exam, you'll be having the Nmcuk. So you don't need to touch the Nmcuk for your own safety, please. So you verbalize. So I'm going to make sure that William is in left lateral position and the buttocks is at the edge of the bed, and the knees are well flexed and the feet are in equal lengths, like they are well positioned. Okay, so I'm going to be sliding in the incontinence pad. That's when you slide in the incontinence pad under the hip and the buttocks of Williams. Okay, Williams, are you okay?
Yes.
All right, that's fine. So I've done the positioning now. So Williams, I'm going to be getting my gauze square. So this is my gauze square. I'll get the lubricating gel. I will apply on the gauze square. So this is my Ducolas. Already, the Ducolas comes in 2 shapes. So we have the apex and the blunt part of it. So when you open it, you open from the apex part. So it depends on the manufacturer's description. So make sure you follow what is written there. So on this one, I can see is the apex part of it. So I'll open from the apex part of it, slide it into the lubricating gel on top of my gauze square. Then I'll now lubricate the Ducolas. And you see what I'm doing? All right, so I'll lubricate the Ducolas properly. After doing that, I'll get the Ducolas, dispose this one, that's the gauze square, into the clinical waste. So, Williams, I'm going to be exposing you minimally. So I'm going to be assessing the area. So you can do any one. You can assess the area first before putting as well. So I'm going to be assessing the area. I can see there is no skin soreness. There is no swelling. There is no redness. There is no hemorrhoid. There is no infestation. There is no redness. Okay. So I'm going to get the Ducola, slide it into the rectum. But before then, you use your left hand, pat the buttocks of Williams. All right, Williams. So I'm going to be advancing the Ducolas 2 to 4 centimeter. Please, in the exam hall, push the Ducolas inside. Advance it 2 to 4 centimeter because they are washing you. So you remember this is a doll. I'm just practical. Like, I'm just showing you the I'm giving you showing you what you are supposed to do. Okay. All right. So I'll advance it 2 to 4 centimeter. All right, Williams, are you okay? All
Yes.
right, that's fine. So I'm going to drop the Ducolas now. Get the gauze square, another gauze square. Then I'll clean the excesses. I'll dispose this in the clinical waste. All right, Williams, I'll take off my hand glove, dispose in the clinical waste, gel my hand. I'll gel my hand. Okay, so I'm going to do my documentation. It's very important. Is if you without you doing your documentation is as well as you not giving the medication at all. So I'll get the prescription sheet. I'll sign. I'll put the date there, the time. Okay. All right, Williams. I'll gel my hand again. All right, Williams. At this point, you can put on your hand glove. So I'm just going to cover you to prevent you to maintain your dignity and your privacy. Is that okay?
Yes.
All right. So I'm going to just take off this incontinence pad now. Then I'll dispose this in the clinical ways. All right, Williams, I'll advise you to stay in this position for 20 minutes if you can. It will help you. So if you need the bedpan, I have the bedpan here. If you're needing the toilet, you just let me know. So I'll advise you to stay in this position just like I told you. Then I'll be coming to check on you for within 15 to 30 minutes time to see how you're feeling. So I'll drop the call bell with you. If there's anything at all, feel free to buzz. I'm going to come to you and attend to you. Is that okay by you?
Yes.
All right. So if you feel any of those discomfort I told you about, that's any of those side effects I told you about, just feel free to let us know. Is that okay?
Yes.
All right. So is there any other thing you would like to let me know?
No.
Okay, so that's fine. All right. So I'll make sure I take this equipment back to the treatment room, dispose the used equipment, and make sure that everything is tidied up. Don't just leave like that. And make sure you end your skills professionally. Is that okay, guys? Did you understand what I've taught you? If there's anything at all or any clarification, just come to under my comment section and make sure you let me know, okay? Please like and subscribe, guys. Thank you so much. See you in my next video. Bye. Please share. Thank you.